Mandatory Influenza Vaccination for Healthcare Workers by Kristen Peters. Influenza is a highly contagious acute respiratory illness that can cause mild to severe sickness. Due to the nature of their jobs, healthcare workers are at an increased risk of both contracting the flu from and transmitting it to those they care for, people who may be at high risk of developing severe complications and potentially dying from it. In keeping with the principles of the profession, it is the legal and ethical obligation of healthcare workers to promote health and not harm their patients. Therefore, to decrease flu transmission and in turn reduce harm to patients, it should be mandatory for all healthcare workers to receive the influenza vaccination. Each year, 10 to 20% of people get the flu and 250 to 500,000 people die from it worldwide. It is one of the top 10 causes of death in Canada. The CDC states that the single most important flu control measure is to vaccinate people at high risk of complications and those capable of transmitting it to them. Some high-risk people either can't get the shot or won't develop proper immunity from it and are best protected when those around them, including healthcare workers, are vaccinated. Getting the flu shot is a matter of patient safety. Studies show that vaccination of healthcare workers leads to decreased patient infection rates, decreased overall morbidity and mortality, and improved patient outcomes. Healthcare workers are primary vectors of transmission to our patients, and by not getting immunized, the healthcare worker is putting themselves at a greater risk of contracting it and also spreading it to their patients, causing undue harm and potentially lethal consequences. There are also significant ethical issues to consider here. The principles of medical ethics necessitate that healthcare workers practice in a way that both promotes health and does not harm their patients. Patients have a right to receive safe, competent, and ethical care. The National Advisory Committee on Immunization considers flu vaccination for healthcare workers an essential component of the standard of care for protection of their patients. Care provided by unvaccinated workers is substandard and maleficent as it puts patients at a higher risk of infection. Not getting the flu shot can also have a negative impact on the healthcare system overall, including longer hospital stays for patients, resulting in increased costs, and healthcare worker absenteeism, which causes uninterrupted healthcare delivery and compromises patient care and patient safety. These both place a great burden on the healthcare system as it affects its ability to function properly. In conclusion, I would like you to consider this. If your loved one was very ill and had to seek medical care in hospital, how would you feel if the staff caring for them had the flu and passed it on to them, causing them a longer hospital stay, severe illness, and potentially death? When someone enters the healthcare profession, they do so with the intention of helping people achieve the best level of health and overall well-being possible. If a flu vaccine can help prevent undue harm and protect and promote the health and safety of patients, it should be a mandatory condition of service for all healthcare workers to receive it. Thank you.